Welcome to Only for Teens on TalkToRadio.com. My name is Matthew, and today we'll be discussing the Zika virus with Dr. Aileen Marty, a professor of infectious diseases at Florida International University, who has taken the time to record her responses to some of our questions. The Zika virus, circulating in different regions of the globe, has been an emerging virus that was recently brought to our attention. It was first identified in rhesus monkeys and has been found in humans since 1952. Different outbreaks have been seen across the world, causing for concern. So Dr. Marty, what exactly is a Zika virus?
Zika is an arbovirus, which means it's a virus that's transmitted by either an insect or a tick, and in this case, it's transmitted by a mosquito, a specific genus of mosquito called Aedes. And a number of different species of the genus Aedes can transmit Zika virus. Not only humans are affected, but non-human primates, so monkeys, some rodents are affected, and it is a virus that has been spreading rather quickly in recent times.
Can you please explain what is the main issue with the Zika virus?
The issue that's going on with Zika right now is that it has been firmly linked with possibly or probably causing babies to be born with microcephaly, which means that they're born with very, very small mal-shaped heads. And it's worse than that because beyond having an unusual appearance, the brain of these babies is severely affected. The cerebrum is severely affected, that part that is important for reasoning. So we're looking at an epidemic, if you will, of babies being born with severe mental retardation.
Why has it been unnoticed for so long?
The key reason it's been unnoticed is because even though the virus was first recognized in 1947 in a rhesus monkey in the Zika forest near Entebbe in Uganda, is because in Africa it's been there for countless numbers of years. There is a fair degree of the population that has immunity to it, and it hasn't caused any outbreaks of any significance. Scattered cases have been recognized. There were suspicious cases in the 50s. There was a very confirmed case in the 60s. Then we started to see cases in Asia. Then in 2007 was the first major outbreak in Yap Island of Micronesia. More recently, in 2013, there was the French Polynesian Islands became affected, and there was a huge outbreak there. Now, in both of those islands of the Pacific, we already started noticing neurologic problems in infants, and of course the possible complication of Guillain-Barré in some adults. Very few, but it does happen. Now, what's happened in the last 2 years is that it's reached the Americas. So in 2015, around May or so, there was a very large number of cases in Brazil, and beyond Brazil, it's now affecting 14 different countries in the Americas. And the Brazilians noted a huge surge in babies with this horrible malformation of microcephaly.
How can it spread? Are there multiple ways?
It spreads by mosquitoes. That's by far and away the most common way in which Zika spreads. And unfortunately, of the 3,000 different species of mosquitoes, genuses of mosquitoes that there are, the one that transmits Zika is the same one that transmits dengue and chikungunya and even yellow fever. So anywhere those diseases exist is a possible place. And in fact, anywhere that those mosquitoes exist, whether or not dengue and chikungunya or other things exist, is a place where Zika could potentially take hold. Once it hit the Americas, where everyone was susceptible because nobody's immune system had seen it before, and the mosquitoes were susceptible and present, it spread like wildfire.
Dr. Marty, are there any treatments or perhaps a new vaccine?
Since it's a virus, you want to know if there's a vaccine or a treatment. We do have, for other viruses, vaccines, and for other viral diseases, specific treatment, but not for Zika. Unfortunately, at this time, there is no vaccine for Zika and there is no specific treatment.
And how should people protect themselves?
Well, as is now recognized, the Center for Disease Control has asked that pregnant women or women who are soon to get pregnant or planning to get pregnant at this time avoid visiting areas where this virus is being actively transmitted, because there is a risk to their infant. And today, the CDC has also recommended that pregnant women who have been to these areas and are back in the United States do get, or even if they're not in the United States, do get themselves tested. This is extremely important. The other things that are important for everyone to realize is that you have to avoid getting bitten by mosquitoes. And this means that if you're going to an area that has mosquitoes, you should definitely try and wear protective clothing, and if the temperature permits, wear long sleeves, long pants, leave as little exposed skin as possible.
What should someone do if they're infected?
Well, the vast majority of adults get no symptoms. 80 to 75 to 80% of people manifest no symptoms whatsoever. Those who do get symptoms, it tends to be a very short-lived illness. You get a rash. It generally starts as the little tiny pink spots on the face and spreads to the rest of the body. You get red eyes. You may have pain in the joints. You may have muscular aches. You'll have a very low-grade fever, and this may last 2 to 7 days, perhaps a little bit longer. So as long as you don't have any underlying disease, it's going to go away on its own, and it's not a problem. The problem is if you are pregnant or about to get pregnant and you get this infection. And last but not least, there is a small but documented risk that a male could transmit the infection sexually to a woman. So men who travel to a mosquito-infected area that is harboring Zika at this time should be aware of that as well, and take that into consideration.
A huge thanks to Dr. Aileen Marty for making this program possible. We all here at TalkToRadio.com hope you've learned something new today about the Zika virus. Thanks for watching.